Kerri from the Pacific Hepatitis C Network. I am back again with Daryl, and today we're going to talk about hepatitis C treatment. So we know in the last several years, hepatitis C treatment has changed from what it used to be. Can you tell us some more about what hepatitis C treatment is like today?
Hepatitis C treatment now, and that's been true for the last 5-6 years, is much easier than it used to be. As recently as 6 years ago, all that was available was interferon and ribavirin therapy, and it was difficult. And for some people, they weren't able to complete. I myself treated with interferon and ribavirin 11 years ago, and it was very difficult. The modern treatments that are available now, and there are a few, are pan-genotypic, meaning, of course, that they work on all genotypes, and the effectiveness is around 95, north of 95%, meaning that nearly 95 to 100% of people who do treat with these new direct-acting antivirals will be cured. The side effects, people often ask me about side effects, and I basically tell them that on the extreme, some people will say that they haven't felt better in years, while others will say that they've never felt worse. And the truth is, for most people, we'll experience minor side effects. Typically, a headache is common, some gastro issues, digestive problems. But generally speaking, from what I hear from people, and I've spoken to hundreds of people who have treated with these medications, the side effects are fairly minimal, and they resolve in a matter of weeks in treatment.
So how is new hepatitis C treatment taken?
It's all oral. Interferon was injection-based, typically subcutaneous, so people like myself would inject into their belly or thigh, somewhere where there was a bit of fat, a bit of tissue, and so all oral, and not all are single pill, but there are options. And again, there are some that have specific benefits over others, and there is one rescue medication for people who may experience treatment failure, and I say the treatment failed because it's not a failure of the person, and generally that occurs from drug resistance with people that have treated before, or they have a genetic marker that will make them resistant to certain treatments.
And how long do people typically have to take a hepatitis C treatment for?
Well, and that's been a big change. The interferon ribavirin era was typically 6 months to 12 months, roughly 24 to 48 weeks. Now it's 8 to 12 weeks. So the duration of treatment is much shorter. Not only much less difficult in terms of side effects, and much more effective, whereas the older treatment was about 40 to 50% effective. New treatments, again, are nearly 100% for all people who treat.
Excellent. And do you talk to people who have difficulty in one way or another accessing treatment, whether that's due to coverage issues or, having issues finding someone to help them get onto treatment?
Well, yes, there certainly remain barriers. It really depends on the jurisdiction. Here in British Columbia, there are no restrictive criteria in terms of how much damage you have to your liver, which was true here up until just a couple of years ago, when that criteria of F2 and greater, meaning stage 2 fibrosis or greater, before people could access treatment, that's gone. There are no restrictions on sobriety here in British Columbia either. But in many jurisdictions, there are still remain restrictive criteria. we're very fortunate here in BC not to have those same restrictive criteria. In terms of accessing treatment, we've certainly through our work, through our helpline and our other work, we have helped people to secure treatment, find a physician, a treating physician, and that kind of activity is part of what we do.
Excellent. If people have questions about treatment, you can certainly contact the helpline, as well as visit our Hep C Treatment Information Project website at hepctip.ca. And Daryl, what is the phone number for the helpline?
Kerri, the number is 1-888-411-7578, and you can text or call us at that number, and we'll do our very best to help you out.
Thanks very much, everyone, and we will talk to you next time.
Thanks, and take care, everyone.